long does our preterm baby has to stay in the NICU? That's one of the questions of the parents of my patient, a late preterm baby. If you want to learn some information about prematurity, then this video is for you. Every year, an estimated 15 million babies are born prematurely, and this number is rising. A week ago, I got this call from the emergency room of Carmeli Clinic and Hospital that there's going to be an emergency cesarean section because the mother has a very high blood pressure of 220/150, and I have to catch the baby. Her baby was born 2 to 3 weeks earlier, so she's called a late premature. Premature, also known as preterm birth, is when a baby is born too early before the 37 weeks of gestation has been completed. Depending on the gestational age of the patient, here are the subcategories of premature birth. One is extremely preterm, wherein the baby is born less than 28 weeks. A very preterm, where the baby is born at 28 to 32 weeks, and moderate to late preterm at 32 to 37 weeks, in which my patient was born at 35 weeks, so she is called a late preterm baby. Baby was admitted at the neonatal intensive care unit. Answer: how long will a premature baby stay in the hospital? Well, it depends. The earlier the baby is born, the higher the risk of death or serious disability. So, depending on their health condition, some babies stay only a few hours or days, others stay weeks or months. Here are the major concerns that should be monitored for premature babies, like breathing problems, like respiratory distress syndrome. The premature baby would develop difficulty of breathing at birth that gets progressively worse. RDS is caused by the baby not having enough surfactant in the lungs. The surfactant is responsible for keeping the lungs from not collapsing. Another breathing problem is apnea of prematurity, wherein the baby stops to breathe more than 20 seconds. Apnea can be caused by immaturity of the brain and weakness of the muscles that keep the airway open. I thank God this baby needed only oxygen support for the first 3 days, and after that, she no longer needed an oxygen. Number 2 is thermoregulation. At first, most premature babies need to sleep in an incubator to stay warm. Premature babies cannot keep themselves warm as compared to full-term babies. Premature babies will get too cold if they are not kept in an incubator or not in skin-to-skin contact in kangaroo mother care. This baby had good temperature control. By the 3rd day, she was already out of the incubator, and when kangaroo mother care was already started. I thank God this baby did not show any signs of infection. Neither did she show any signs of jaundice or the yellowish discoloration of the skin and hypoglycemia, which is low blood sugar. She has no feeding issues. She has already established breastfeeding by the 3rd day of life. This baby has passed all the discharge milestones, so I think she's ready for discharge. Wow, I'm so happy. Finally, I'm sending this baby home. I thank the parents, the nursing staff, for helping me take care of this baby. I hope you learned something from this video. Please subscribe to my YouTube channel, Health.Faith.Fullness. And go on, click the bell icon so you will be notified with my upcoming video. Happy Easter!